epilepsy is also known as seizure disorders. It's growing very alarming conditions in our country. It's more because of this awareness is very poor. So it is important for us doctors to give more awareness about the epilepsies to our societies. Getting the awareness first is always essential to know what is exactly epilepsy. Epilepsy is nothing but the disturbance in the electrical impulses which is discharged from the brain at regular intervals. When there will be the electrical impulses does not discharge in a synchronized manner, the outcome of the movement, what we call it, is seizure. It is curable 100%. It is not a life-threatening disorder. What everybody, our society thinks it is. It can be curable at the early stage. And to know more about these medications, activities, this is more essential to control the epilepsy. What exactly of this one individual, each patient or their patient attenders thinks, once will take the medications, your epilepsy will get controlled. That's it. But these medications only just give 50% of the ratings. Another 50% has to come from the another 3 more factors, activities, what we call it a contact therapy, then it's a diet and lifestyle, and last and least is sleep. Good sleep, monitoring of the activities, proper diet with proper medication and timely manner helps to cure the epilepsy 100% within a very fast duration of time. I hope you like the videos. The awareness, the information, what you got it is, you will share with your friends, relatives, colleagues. It will be more useful to the societies and to help to the doctors to treat the faster. In the incidents, the patient which comes to the clinic or visit to the doctors, they are at the earliest stage of the epilepsy episodes, then you can treat with very short span of time. If it comes at the later stage, it will be for doctors, for us, like it will be more difficult to treat very short of spines. So that takes a more longer time. And medications, once again I would like to bring your things, attentions. Medications with that contact therapy is very essential. What is called contact therapy? It is the patient or this just to take an example, it differs from the adult patients and the pediatric cases. For the adult, their routinely lifestyles, their activities, in their job, their activities has to be continuously monitored, and stress is a more contributing factor. Stress they are during their workplace or in the family, stress always will be avoided. This one, if they will avoid, it will be more faster recovery. Stress, head injuries, or smoking, alcohol, all these things is an aggravating and contributing factor for this. In case of pediatric patients, more thing is the contact therapy. Contact therapy, exactly what is that? If the child gets up from the morning till the child sleep, go to the deep sleep. That is more essential to monitor the activity, bring the child attentions, what the child needs it. If this will monitor this one properly, then this pediatric epilepsy, these seizures will be controlled very short span of time.
Recollect the experience of seeing a person suddenly having a severe attack, falling to the floor unconscious, with his hand or legs continuously twitching or moving uncontrollably, drooling or froth from the mouth, or even losing bladder control. Within minutes, the attack is over, and the person regains consciousness but is exhausted and dazed. This is the image most people have when they hear the word epilepsy. This strange behavior caused by some disturbance in the brain has contributed through the ages to many superstitions and prejudices. The word epilepsy is derived from the Greek word attack. What is epilepsy? Epilepsy is a brain disorder in which nerve cells or neurons in the brain sometimes signal abnormally. Many believe that having a seizure equates to having epilepsy. Although the two terms are often used simultaneously, a seizure is a single sudden electrical discharge in the brain causing alterations in behavior, sensation, or consciousness. Whereas epilepsy is defined as two or more unprovoked seizures. Seizures are fundamental elements of epilepsy, but not all seizures are manifestations of epilepsy. In India, around 5 in 1,000 population suffer from epilepsy. Epilepsy is more common during early childhood and after the age of 60. Causes of epilepsy. Epilepsy may develop because of an imbalance of nerve signaling chemicals called neurotransmitters. In about half of the people, the cause of epilepsy is unknown. When there is a cause that can be found, it can be head trauma, genetic factors. Some types of epilepsy run in families, and researchers have linked epilepsy to specific genes. Diseases such as AIDS, viral encephalitis, and meningitis. Prenatal injury. Babies are sensitive to brain damage that could be caused by several factors, such as an infection in the mother, poor nutrition, or oxygen deficiencies during pregnancy. Who is likely to develop epilepsy? Some things make seizures more likely for some people with epilepsy. These are often referred to as triggers. Triggers are things like stress, insufficient sleep, drinking too much alcohol, missing meals, not taking your epilepsy medications, and exposure to lights that flash or flicker. Certain factors may increase your risk of epilepsy, such as age, more common during early childhood and after the age of 60. If you have a family member suffering from epilepsy, brain infections can increase your risk, hence should be treated properly. Past history of head injury due to accident. Symptoms. Symptoms vary from person to person. Some people may have simple staring spells, while others have violent shaking and loss of alertness. Some people with epilepsy have a strange sensation such as tingling, smelling an odor that isn't actually there, or emotional changes before each seizure. This is called an aura. Commonly, epilepsy presents as intermittent.
More important to share with your friends, colleagues about epilepsy, which will be more treatable if you create the awareness more and faster. Then we can treat each individual at the early stage. Always prevention is better than the cure. So at the early stage, if the patient comes to the doctor, it will be easier to us to treat and they will be therapy. We are very sure take the maximum 1 to 2 years of durations. If any kind of things, if you want to reach me, any information at any time, you can contact our epilepsy helpline number 934 11 40 300. Thank you.